There is positive news on the coronavirus front in the United States. The reported number of new COVID-19 cases is below 30,000 for the fifth day in a row. More than 156 million Americans have received at least one dose of a vaccine. That is more than 60% of all adults. But now many people are waiting to hear if they will need a booster shot. Dr. Anthony Fauci told CBS this morning health officials are preparing for that possibility.
The fact is we don't know, but it would really be foolish not to plan for the possibility that we might have to boost people. We just keep following the durability of the response. And if the time comes when we'll need to boost people, we'll at least have enough data, because we're doing the studies now, to know what we expect to see when we do boost people.
I want to bring in Dr. Julie Morita now. She is the Executive Vice President of the Robert Wood Johnson Foundation and a former Chief Medical Officer of the Chicago Department of Public Health. Dr. Morita, welcome. Great to see you again. So we just heard Dr. Fauci say it's not yet clear whether we will need a coronavirus booster shot. Why is there such hesitation to say whether a booster will be necessary?
I think it's important to understand that there's multiple factors in determining whether or not a vaccine booster will be required. I think we have to look at how long immunity lasts, how high the levels of immunity are over time, and then also to understand what disease is circulating, how high are the rates of disease. You pointed out earlier that the rates of disease and the number of cases are much, much lower now. So we'll really have to keep a close eye on how many cases are occurring and what percentage of those are the variants, and also how long does the immunity last from the immunizations before we make a determination about whether boosters are actually necessary or not.
And Dr. Morita, as you know, CDC guidelines on mask wearing and social distancing are evolving for those who are vaccinated, but it's no secret there are a number of people who either refuse to or simply can't get the vaccine. So if we never have 100% of people vaccinated or close to 100%, at what point does the mask wearing and the social distancing just peter out, not just for people who are vaccinated, but for everyone?
I think a key concept to keep in mind related to the masks is that we know that the masks work. They actually help protect individuals who are wearing the mask and also helps prevent spreading of disease from people who are wearing masks to others. And so they're really an important tool when we have disease spreading throughout our communities. So rather than focusing so much on how high vaccination rates are as a measure for when we should stop or start wearing masks, it's really a matter of thinking about how much disease is actually circulating. What is the risk for transmission of the disease when we think about when it's appropriate or when it's not appropriate to wear a mask? I mean, the message that we've heard from CDC is strong. The people who have been vaccinated are very low risk of getting disease and also very low risk for transmitting disease. But for people who are not vaccinated, they remain at high risk for getting disease. And so wearing a mask is still critically important.
So Secretary of Education Miguel Cardona has said he is confident students will be able to return to school full-time in the fall. With some kids vaccinated, though, and others who are not, what rules or guidelines do you think school districts may need to adopt to keep students and teachers safe?
So earlier this year, CDC issued some guidance related to what measures should be in place for schools to reopen safely, because we all know how important it is for our children to be in person learning. It's just so much better for our kids to be able to interact socially with each other and then also to benefit from instruction in person. So we want schools to be open. The measures that are included, though, include things like mask wearing and improved ventilation systems. And the CDC just released a report today that demonstrates that when there are good ventilation systems in place, whether it's a matter of keeping windows and doors open, or whether it's a matter of having filtration systems in place to pull out or clean the air itself, that, along with teachers and staff wearing masks, can really reduce the number of cases that are occurring in school settings. So schools can be open safely. It's a matter of just having the appropriate protections in place.
Dr. Julie Morita, thank you so much for joining us. We always appreciate your insight.
Thanks, Tanya.